It is a great satisfaction to greet you again. I hope you and your pet are well. Today we will talk about the following. My dog's front legs fail, why? Lameness or walking problems can occur in any of a dog's limbs. Although traumatic injuries can occur anywhere, limb paralysis most often occurs in the hind legs. This is due to the location of the spine, since injuries or pathologies that affect the spine usually appear later. When the dog's forelimbs fail to walk, the location of the lameness can help us determine the cause. Paralysis, muscle weakness, or orthopedic abnormalities may be the root cause, but we won't know until we take him to a vet for evaluation. Mobility problems can have very different origins and prognosis. Depending on the age of the animal and its history, it is possible to estimate this, but it is always imperative that an animal that has mobility problems in the front legs be examined by a veterinarian. When these mobility problems appear, it can be abrupt, since they can occur after a stroke, interruption of blood flow in some area of the brain, or progressively if we talk about degenerative diseases. Apart from how it appeared, it is necessary to take into account what type of problem is present. If the animal cannot get up, if it is a slight limp, if it gets worse when it gets up, it will be very important to determine when it appeared, in what way and how it affects life daily. Some of the most common causes of these problems are injuries. It can be from a slight limp due to the pain of the impact or bruise in later days, to a bone or ligament fracture, so after identifying a mobility problem it is best to see your vet as soon as possible to relieve the pain or remedy possible fractures. Infectious diseases in puppies, unvaccinated animals or animals that have been parasitized by ticks is much more likely, but can occur in vaccinated or dewormed animals. Distemper and ehrlichiosis, transmitted by ticks, are the most common diseases that can present with these symptoms, but they are not the only ones. The appearance of mobility problems may be associated with other symptoms such as tremors, apathy, fever, runny nose, among others. Musculoskeletal problems, conditions such as osteoarthritis, calcification of the ligaments, autoimmune diseases that affect the muscles and conditions of the spine are some of the possible causes of loss of mobility in the front legs, which will require a traumatological examination and possibly tests such as X-rays, ultrasound, MRI, among others. Metabolic diseases such as diabetes, hypothyroidism, and hyperthyroidism. To arrive at a diagnosis of any disease that affects mobility, it is necessary to carry out many analyses, and sometimes it is essential that the animal be admitted to the hospital so that it remains stable until appropriate treatment is given. Tumors. It is possible that the presence of tumors can cause mobility problems, which can be located in the brain, spinal cord, or in the extremities. Neurological problems, diseases with damage to the nervous system such as the infectious diseases mentioned above, degenerative diseases that affect the nerves such as degenerative myelopathy, problems in the brain, stroke, injury or infection, damage to the spine or plexus brachial, the set of nerves that runs from the spinal cord to the extremities, poisoning, whether accidental or induced. Any of these problems may be the reason why our furry dog has trouble moving or using his front legs normally. It is best to contact a good doctor and follow the recommended treatment guidelines. Sometimes the prognosis is not as good as we would like, but we must be optimistic and do everything possible so that our dog's quality of life is the best we can offer it. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. Take care of yourself and your furry friend. A hug, and until the next video.